Good morning, everyone. It's such a pleasure to be here and to be part of the great works that Mr. Adegoke and his team are doing with the SDG or in the SDG sector, with the organization, the Instride Pathways Academy. And I'm glad to be here to talk to you briefly about universal health coverage and it being a realistic goal for global health equity. My name is Kehinde, Joan, Abayomi, and I'll take you on this short journey of universal health coverage. And I hope not to take much of your time. And hopefully in the next 15-20 minutes tops, we should be done. Okay, so just to take you back to a review of what the Sustainable Development Goals are. Currently, we have 17 Sustainable Development Goals, and works are being done in each of this sector to be able to attain. So one of the first one is that there should be no poverty and that there should be zero hunger. And the one that I'll be focusing on majorly is SDG number 3, which is good health and well-being. However, one of the things that I've come to realization is that you cannot have good health and well-being when the people you're trying to give the good health and well-being are hungry, when they don't have quality education, and when there is gender inequality, or when they don't even have clean water and sanitation, when their lives on the planet Earth is not even safe, when the climate weather or the climate condition it's not favorable, people cannot have good health and well-being. And this was good to tell us that all these 17 sustainable development goals are dependent on each other. You cannot achieve one without the help of the other. They are all depending on each other. So in as much as we are going to be focusing on goal number 3, which is good health and well-being, we also want to look at other goals, because you cannot achieve good health and well-being, like I said earlier, without every of the 17 goals. Okay, so SDG 3 at a glance. Basically, what SDG 3 is telling us is that we want to have good health and well-being for the entire population on Earth, right? And for us to have this good health and well-being, this SDG 3 has been categorized into different targets just to make it easy for sectioning and easy for it to be achieved. So the first target for SDG 3 is that we want to reduce maternal mortality. And maternal mortality basically talks about mothers dying at the point of giving birth. And this is one of the commonest causes of death in Nigeria, basically because we don't have good healthcare sector. And so you have women who are pregnant and don't even have access, to healthcare. They don't have access to antenatal care. And so most times when they come to the point of giving birth, they end up with complications and at the long run death, right? So one of the targets is to reduce maternal mortality, to fight communicable disease, to prevent and treat substance abuse, which is one of the things that it's currently affecting the younger generations. One of our targets today is target 3.8, which is to achieve universal health coverage. And what universal health coverage basically means is that people have access, to full range of quality health services that they need, when they need them, where they need them, and without financial hardship. And this has been one of the biggest challenges of healthcare, that you get access to healthcare services when you want them, where you want them, and without having any financial hardship. If we're being realistic, I think this is far-fetched from achieving the universal health coverage goal for 2030. And using Nigeria as a point of contact, I think, I might not be sure with my statistics, but I think that currently not up to 50% of Nigerians have access to healthcare when they want it, where they want it, and then being able to afford it without any financial hardship. And so universal health coverage actually covers a broad spectrum of essential health services, in the sense that we look at the aspect of health promotion and prevention. We look into the aspect of treatment, we look into the aspect of rehabilitation, and even palliative care, right? Palliative care talks about care that you give to the older people or people who are in end-stage diseases, like people with chronic kidney diseases that they need to be managed to the point of death. So On this slide, I'm basically trying to show us a glance of what SDG 3, or rather what the target 3.8, which is universal health coverage, what has been done so far, and the challenges we still have. Okay, so coming from here, we can see that 146 out of 200 countries have already been able to meet one of the targets that, like I said earlier, that we're supposed to, one of the targets, which is target 3.1, is that we reduce maternal mortality. And according to statistics, about 146 countries out of 200 countries have actually been able to, meet up this track. And another achievement so far is that death has reduced. Effective HIV treatment has actually has been in place, and about 52% of the global population have access to HIV treatment, which is actually possible, and that at least one neglected tropical disease has been eliminated in 17 countries in the world. However, what are the challenges? With the advent of COVID-19 in 2019, so about 25 million children have been able to miss their immunization in 2021, and this was as a result of the global pandemic. Everyone had to stay home, everyone needed to be safe, and so everyone was at home. I believe that is why we have this high increase in numbers as opposed to what we had in 2019. So there was about 6 million increase, from 2019 to 2021. And even looking at malaria cases all over the world, we have an increase. In 2019, we have about 232, million cases. And in 2021, we have about 247 million cases of malaria. This just goes to tell you that the target 3.8 is still far-fetched from being achieved in 2030. This is already 2024. And currently in Nigeria, we are nothing close to having complete malaria eradication. And we know that one of the commonest causes of death in Africa is malaria, especially in Nigeria. And this is one of the worrisome statistics, that a woman dies every 2 minutes, from preventable causes that are related to her pregnancy and childbirth. How can we ensure that there is good health and well-being if a woman dies every 2 minutes at the point of giving birth or in the course of her pregnancy? This is really alarming and it's scary, right? So for us to achieve universal health coverage, we need to look at each of the targets, and each of the targets needs to be met for us to be able to achieve the global health and well-being for every life on earth. And so the universal health coverage has a mission and a vision for it to be achieved in 2030. And the mission, or rather the vision, is that we want a world where all the people have access to the full range of quality health services that they need, when they need it, where they need it, and even without any form of financial hardship. And their mission is to accelerate sustainable progress toward universal health coverage, and they do this by focusing on building equitable and resilient health systems in such a way that no one is left behind, and that they are able to provide foundation to achieve health security. Okay, so what are the key facts about the universal health coverage 2030 so far? And so one of the things that I think is pretty interesting is that there have been improvement on health services. However, since 2015, these health services improvement have been stagnated, and the proportion of the world population that has faced or that have suffered out of the pocket health spending has increased largely since 2020. And I could attribute this to COVID-19 pandemic, but beyond that, people have had to spend so much money out of their pocket to pay for healthcare services. If we're talking about universal health coverage, is that people also should have access to, health insurance that they could afford, a form of payment that would be easy for them to do. I think currently in Nigeria, we have some form of health insurance, the National Health Insurance Scheme. I'm not sure how equitable that is, but I know that some government workers have access to NHIS. And so I believe that if people have access to NHIS, at every form, at every level, not just for government workers, then it is going to reduce out of the pocket spending, and we'll probably have a better statistics in 2025. Another thing is that the proportion of the population that is not covered by essential health services actually decreased by about 15%. So, taking Nigeria again as a point of example, is that more than 15% of Nigerians do not even have access to essential health services. And I know that we have primary health centers in different local governments in the state. However, how effective are the functions of these primary health centers? I know I've visited a couple of primary health centers, and then you go to these primary health centers in Nigeria, and either the doctor is not available, or even the nurses that might be available to attend to you are not even they are not well trained. You end up having quacks in the hospital attending to people. And so even when you have access to the health, you're not having access to quality health. And again, like I said earlier, one of the aim of universal health coverage is that you're having access to quality health, not just any health. You're having access to quality health. Another key factor is that when we look at the service coverage, the universal health service coverage has actually increased from 2000 to 2021. However, there has been a decline again because of the COVID-19 pandemic. But we are hoping that now that things are getting back in place between 2022 to 2026, there should be a great improvement in the health coverage. And finally, about 2 billion people are facing financial hardship. Currently, I think the world population is about over 7 billion. So if we have about 2 billion people facing financial hardship, it means that up to 20 or 30% of the global population are facing financial hardship. And this is mostly as a result of the spending that they have to do on their healthcare. I know that in Nigeria or even in other parts of the world, America, for example, if you fall sick with a chronic disease, let's say you come down with chronic kidney disease, if care is not taken, you end up spending all your life saving treating just one disease. And then you can go into bankruptcy because you are treating just one disease. And so imagine you being a middle class, moving from being a middle class with your level of income to being actually poor because you had to pay for your own health care. This is really alarming. And that is one of the goals that the SDG3 is hoping to achieve, that through the universal health coverage and health insurances, that people are able to access quality health care without even them spending so much from their pocket. I mean, it's not going to be free, but that you're not spending so much to the point that it's affecting your financial status. Okay, so what are the 3 pillars to achieving universal health coverage? To me, one of the important pillars, or the most important pillar, is access. If someone is in Lagos and another person is in the most rural part of Nigeria, let's say in Maiduguri, that person should be able to have access to the same healthcare that the other people in Lagos are having access to, And so the access is that everyone who needs health services should be able to get them, not just those who can pay for them, right? So if someone needs to have surgery, it should be that because I don't have money to have the surgery doesn't mean that I shouldn't have the surgery. I should have the surgery because I need the surgery, not because I can pay for it, right? And so access is very important. Another thing is financial protection. You cannot achieve universal health coverage when you don't protect the finances of the people. People shouldn't go into debt because they are paying for treatment. Even basic medicine, that something as basic as anti-malaria drugs, antibiotics, even the vaccines you receive, you shouldn't have to pay so much money to get vaccine. I know, there are some vaccines that you can't get, from hospitals. You need to pay for them, especially for children. So I think it is really important that people need to be financially protected. If you don't protect the finances of people, how do you achieve universal health coverage? Again, universal health coverage cannot be achieved if people do not have access to healthcare and their finances are not protected. And finally, quality. Like I said earlier, the goal of universal health coverage is that everyone should be able to have access to quality health when they need it, where they need it, without any form of financial hardship. And so you cannot give people health care when it is not quality. You cannot give someone drugs for malaria when the person needs antibiotics, right? So we need to be able to have quality health services. We need to be able to have quality doctors at every hospital, at every government hospitals. When I go to government hospitals, I should be assured that the services I'm getting from this hospital is from a quality trained doctor, from a well-trained nurse, from a well-trained medical laboratory scientist, from a well-trained pharmacist. And this can only be if we are hoping to achieve universal health coverage. And so this is just to give us an overview of what universal health coverage, what it entails. Again, like I said, that it needs to be quality. You can't give healthcare that is not quality and say that you're giving healthcare. So we need to have quality healthcare. The healthcare needs to be people-centered. Now, one of the things that I have noticed in Nigeria is that government just come and build hospitals in different areas, and they say, oh yeah, we built hospitals. You don't just come and build hospitals. What are the peculiar things to the people in that community? If that community is a community that is suffering from, let's say, schistosomiasis because they are living in a riverine area, are they going to have access to services that would, take care of that disease when people come down with schistosomiasis? So the healthcare that you're going to give people need to be people-centered, right? You cannot give, how do I say this? You don't give the same treatment to everybody. No. The treatment that you give needs to be people-centered. If I'm coming down with malaria, I should be treated for malaria. If I'm coming down with sepsis, I should be treated with antibiotics because I have sepsis. I shouldn't be giving anti-malaria drugs when I have sepsis. So the healthcare that you give people beyond being quality healthcare, it needs to be people-centered and it needs to be integrated. Again, when you are forming a healthcare center, you need to bring the people of that community in making these decisions, in making interventions for them. And above it all, they need to be able to afford it. That's why I talked about the financial protection from my previous slide, that the three things that we need in achieving universal health coverage is that we need to have access, people need to be able to afford it, and it needs to be quality, right? So accessibility, which talks about the equity, everyone should be able to access universal health coverage, everyone should be able to access basic health care, and the services should be available wherever, whenever it is needed, and that it needs to be of great quality. And this slide is just giving us an overview of what universal health coverage is. Again, universal health coverage is not just health insurances. This is because when we say universal health coverage is not just about health insurance, is that yes, health insurance is important, but beyond health insurance, not everybody would be able to afford a health insurance. You cannot tell somebody in the most rural part of Nigeria who is living on less than 200 naira a day to have health insurance. Some health insurances are as high as 5,000 naira in a month, or as high as 200,000 naira in a month. If someone is struggling to have three square meals rather in a day, how do you expect the person to afford health insurance? This just go to tell us that universal health coverage rather is not health insurance. And so if we want to have universal health coverage, we need to talk about equity. And that is where people having access to basic healthcare services comes into play, that irregardless of who you are, irregardless of your financial status, you should be able to have access to basic healthcare that is provided by the government for the people. And the universal healthcare coverage requires a strong healthcare system. One of the challenges we have in Nigeria is that we have a terrible healthcare system, very, very terrible. We have Minister of Health, and at some point you even wonder what they are doing, because it's like they focus the healthcare system in the urban region of the country. You have the best healthcare system in Abuja, in Lagos, in Kano, the big cities, in Port Harcourt. What happens to places like Yobe? What happens to, Ebonyi State? What happens to other states that are not as big as Lagos and Abuja in terms of their GDP? What happens to them? Do they not deserve to have the best healthcare system? So one of the goals that universal health coverage is fighting for is that everyone should have access to strong healthcare system, right? And that universal health coverage is not a one-size-fits-all approach. No. Again, what you would do for someone in Nigeria would be different from what you would do for someone in Algeria, which is in Northern Africa. So you need to sit down and look at the infrastructure or the things that will work for someone in Nigeria and the things that will work for someone in another part of the world. For example, you have America. America doesn't have malaria. You cannot be pushing finances or healthcare financing to America and say that you're targeting malaria. Malaria is not their problem, right? You would want to focus that one on Nigeria. So this just go to tell us that universal health coverage is not a one-size-fits-all, and that universal health coverage can actually improve health outcomes. I mean, that is the goal of universal health coverage, that at the long run, your health is improved, and even as your health is improving, your finances are being protected. Okay, so just to give you an overview of the trends of the coverage of universal health services and all. This is pretty interesting because looking at this map, this is Nigeria. Nigeria is at a balance of 44 to 47. I'm struggling to believe these statistics because I don't think Nigeria has gotten to. I feel Nigeria is way at 39 to 43 in terms of our own universal health coverage. I don't think we have much health coverage in Nigeria. You cannot go to the most rural part of Nigeria and have access to quality health care, all right? One of the few places that have actually made significant progress in their universal health coverage service is, the southern part of Africa. We have South Africa, I think this should be Botswana. And then you come to North Africa where you have Algeria. And these are countries that have been amazingly well for themselves in terms of universal health coverage. And so, like I have been saying, universal health coverage is not a standalone thing. And when we achieve universal health coverage, it will in turn affect every other part of people's life. Like I said earlier in my first slide, that good health and well-being is dependent on every of the other SDG goals, right? That you cannot achieve good health and well-being when you are poor. You cannot achieve good health and well-being when your lives are not safe on the planet. So basically, this slide is just to tell us that universal health coverage is not a standalone thing that is dependent on every of the other 17 or rather 16 development goals. And what I try to do here is just give you an overview of some of the most important ones that I think is interconnected with universal health coverage. So, human rights. We're trying to protect the human rights is that you cannot protect human rights when they do not have access to healthcare, right? You cannot eradicate poverty when people do not have access to universal health coverage. Again, remember, the goal of universal health coverage is that people are able to have access to quality healthcare when they want it, where they want it, without any form of financial hardship. So if universal health coverage is not putting you on any form of burden for financial hardship, then I feel that through that there will be some form of eradication of poverty because you're not having to spend so much on your healthcare. If you don't spend so much on healthcare, you have much more left, to spend on other parts of your life, maybe for your feeding and for your housing, and that equality and non-discrimination. So what is the importance of universal healthcare? I've been saying this and I'll keep saying this, is that everyone is able to have access to healthcare. Everyone is important, regardless of who you are, what you have, or what you don't have. You should be able to have access to at least basic healthcare, and that improve health outcomes. One of the things that universal health coverage is also planning or is hoping to achieve is that if you come to a healthcare setting, you should be able to come out with an improvement. I know it's not almost always possible. Sometimes you go to a hospital and things happen and the person doesn't make it. But that is not the point. The point is that when I come into a healthcare setting, let's say I have malaria and I come into a healthcare facility, the goal of it is after treatment, my health outcome should be improved, right? That is the goal of universal health coverage, that you come to access healthcare and at the end of it, your health outcome is improved. That you should have economic benefit and social benefit. Yes, this is important. You cannot be socially happy if you are not healthy. And universal health coverage wants you to be happy, wants you to be healthy, and wants you to have enough, so that you don't spend so much on healthcare, so that you can have enough for other things in your life, and so that you can have access to other social benefits. So, remember, we are talking about global health coverage and how global health equity is important in achieving global health coverage. So I feel, or rather, I know that the word equity, right, actually means that there is absence of unfairness. Equity is that you treat people not necessarily equally, but how they ought to be treated. You know, that you try everything possible to ensure that the services that is needed by everyone, they get the services for their own condition, for their own situation, right? So you are trying to make it equitable across the globe, equitable across the globe. So basically, when we're talking about global health equity, it is the idea that everyone should have the same opportunity to achieve their full health potential, regardless of their social position or even other factors. And like I said earlier, that global health equity can only be achieved through universal health coverage. And an example of global health inequality, for example, is discrimination. This is one of the commonest things we have in Nigeria. Let's say I come to a healthcare facility as a young girl, let's say unmarried young girl at the age of 13, and I'm coming to say I'm pregnant and I want to have access to healthcare. I want to have access to antenatal care. One of the first things that the nurses would say to me is, I think, not even I think, first I'll be discriminated because as a 13-year-old girl, you're not expected to be pregnant. Yes, you're not, but then it happened. Should you be discriminated because this happened? No, you should be able to have access to healthcare irrespective of your situation. Another good example is people with HIV. When people come to the hospital and they reveal their HIV status, they get discriminated, you know. The idea behind global health equity is that nobody should be discriminated. Everyone should be treated fairly and equitable. And so this is just a framework of how, the strategies that we can use in achieving global health equity. One of the important ones to me is that you're centering your equity based on quality and payment, and that this means that when you pay money, you should be able to get good quality, right? But beyond paying the money, everyone should have access to quality health. And like I said earlier, that when you have universal health coverage, then it should be able to improve the social determinants of our health, and that we should also be able to hold our the health system accountable. When something is not working out, we should be able to speak out, and the government should be able to respond to us. And that we should even be able to improve and integrate physical, behavioral, and also our oral health. Basically, the hallmark of it is that we should be able to engage our patients, our families, and our caregivers. I am a medical person, and I know that sometimes this might seem unrealistic. It might seem like it's far-fetched from being achieved, but I know with universal health coverage and with the aim of achieving all universal health coverage by 2030, I believe that if all hands are on deck, then this is definitely achievable. But so far, what are the challenges in achieving the universal health coverage for our 2030 target? I think one of the most important ones is unregulated delivery system, right? And this is covering about 19% of the challenges that we have. Unregulated delivery system. And it's one of the commonest problems we have in Africa, Nigeria specifically. I'm saying Nigeria because I am from Nigeria. It's nothing is regulated. You build a hospital today and nobody goes back to check how well this hospital is functioning. You build a health center, and it's not just about building health center. How do you manage it? How do you sustain that health center to be able to serve the needs of the people in that community? Then we have lack of quality. And another thing is we have an aging population. When you come to Europe, you come to America, we're having an increase in aging population. And when we have increase in aging population, it means that the percentage of young people that are available to work is reduced. When you have reduced hands to work, it implies that you're going to have challenges in achieving your goal, because the people that would actually work to ensure that we achieve universal health coverage 2030 is the younger generation. But when we have old people in the population, rather, we're instead using our energy in taking care of the old people instead of using our energy to even serve the younger people, right? So this is like a big challenge. Another challenge is failures in services expansion. We need to be able to expand our services to be able to reach everyone. Again, I keep saying this. Remember that the goal of universal health coverage is that everyone, everywhere should have access to quality healthcare services when they need them, when they want it, without any form of financial hardship, right? So what is the way forward? How do we achieve universal health coverage? We've been talking about the challenges. We've been talking about, things that should be done, that haven't been done. How do we move forward? How do we achieve universal health coverage? Again, we have the goal of achieving this in 2030. We're already in 2024. We barely have 6 years to go. How can we achieve this goal in 2030? So I have a few points here, and I said that we should have services that are focused on the people. People are important. If you are serving the people, then you should have services that are focused on them, people-centered services. And you can only do people-centered service when you communicate with the people that you are doing the services for. You ask questions. What are their challenges? What can you do to improve their healthcare access? And then we also need to invest in subnational health systems. This is a challenge in Africa because, like I mentioned earlier, you come to bigger cities like Lagos and you have all the healthcare that you need, but then you go to rural areas and then it becomes a challenge, right? So we need to invest in subnational health system. We also need to digitalize health system. Well, this might be a bit of a challenge again in Nigeria because we don't even have constant electricity. How do you make things digital when you don't have at least 24 hours of electricity? You come to the hospital and let's say that they cannot pull out your record because the computer is down and there's no electricity, But generally, I feel that when we digitalize our health system, it could or is a way of achieving universal health coverage, because then you would be able to have access to your health information at every point in time. You can be in another part of Africa and I can reach out to my healthcare provider in Nigeria, and my healthcare provider in other country in Africa would have access to my health information because it is digitalized. When it is not, then it becomes a challenge. Another thing is that we need to prioritize community-led services and self-care, and then we need to increase health system resilience. I have down here again that we need to increase public funding for healthcare. It's very important. If we want to take away financial hardship on people, we need to increase the funding for public healthcare. And we need to also emphasize preventive care. Again, if something can be prevented, it should be prevented. The goal is that we should prevent it. We shouldn't allow it to get to the point of it becoming a disease. So I think that there needs to be more focus on prevention. People need to know what they can do to prevent themselves from having diseases. It's like malaria. What can I do to prevent myself from having malaria? Well, I keep talking about malaria because Nigeria is a malaria endemic region. So, what do you do to prevent yourself from having malaria? You use your mosquito nets, you ensure that your environment is clean. These are the basic things. So preventive healthcare is very important, and we need people to know. How do you prevent yourself from having heart diseases? Don't consume alcohol, do exercise, ensure that you are not obese, eat healthy. So preventive healthcare is very important, and people need to be made aware of that. For you to achieve universal health coverage is that we need to place emphasis on preventive healthcare. And we need to strengthen our primary healthcare system. I've been saying this from the beginning of my presentation, that primary healthcare is in shambles in Nigeria. We need to strengthen it. I should be able to come to a primary healthcare center in a rural area and somewhere in Sokoto or Ebonyi. I should be able to see a doctor, a trained doctor to talk to me, to listen to me. I should be able to have access to quality healthcare providers in a primary healthcare setting. I shouldn't have to travel from one rural area, to Lagos for kidney transplant, or for me to be able to see a cardiologist, for me to be able to see a nephrologist. No, I should be able to have access to, these basic things, even at the primary health care level, and then we need to promote public-private partnership. This is important because sometimes the government might not be able to reach everyone. And so when we have public-private partnership, it's in a way would improve or help us in achieving universal health coverage. Okay, I want to believe that we've learned one or two things from this presentation. What I wanted to do with this presentation is that you people need to know that universal health coverage is important, it is achievable, and we are hoping that in 2030, the goal of the SDG is that in 2030, we'll be able to achieve universal health coverage. Again, we cannot achieve universal health coverage if people don't have access to healthcare. if the healthcare is not quality, and if they have to spend so much for the healthcare. No, right? So the aim of this presentation is for you to know what universal health coverage is, the importance of universal health coverage, and that everyone should be able to have access to universal health care. And I hope that with these few sentences, I've been able to, enlighten you about what universal health coverage is. And I hope to hear from you also. These are some of the references I used. And if at any point in time you want to reach out to me, yeah, these are my email address, and you could reach out to me. Again, thank you so much, Adegoke Adeyinka, for such an opportunity and for all the works you are doing with the Instride Pathways Youth Foundation. I believe this is something very important that the youth need to know, and I'm glad that you're inculcating the secondary school students into this. This is amazing, and yeah, I hope to hear from you all soon, and I wish you all the best. Thank you.